Strategies for preventing dental disease in pediatric patients. Greetings, everyone, and welcome to today's lecture on the prevention of dental diseases in pediatric patients. As dental professionals, it's paramount for us to understand the crucial strategies in safeguarding the oral health of our young patients. Today, we'll delve into 5 integral components of pediatric dental disease prevention that cornerstone of our approach. Parents counseling. We recognize the pivotal role parents play in shaping their child's oral hygiene habits and overall dental health. Effective communication and guidance to parents are fundamental in fostering good oral care practices at home. Dietary management. The foods and beverages children consume significantly impact their dental health. We'll explore strategies for promoting a balanced diet that supports optimal oral health while minimizing the risk of dental caries and other oral issues. Fluoride delivery. Fluoride remains one of the most effective tools in preventing tooth decay. We'll discuss the various methods of fluoride delivery, including topical applications and community water fluoridation, highlighting their importance in strengthening dental enamel and preventing cavities. Pit and fissure sealants. Sealants provide a protective barrier against dental decay by sealing off the vulnerable pits and fissures of the teeth. We'll examine the indications for sealant, application techniques, and their role in preventing caries, particularly in molars, among pediatric patients. Preventive resin restorations. Early intervention is key in halting the progression of dental caries. Preventive resin restorations offer a conservative approach to treating initial carious lesions, preserving tooth structure, and preventing further decay. Throughout this lecture, we'll explore each component in depth, discussing their significance in pediatric dental care and practical strategies for implementation. By understanding and incorporating these preventive measures into our clinical practice, we can empower our young patients to achieve lifelong oral health and well-being. Let's explore these essential components together. Plaque control. At the forefront of our preventive measures lies plaque control and effective toothbrushing. This pillar involves instigating behavioral changes, empowering children and their parents with the knowledge and skills necessary for maintaining optimal oral hygiene practices. Through proper brushing techniques and regular plaque control, we aim to mitigate the risk of dental diseases and promote long-term oral health. Diet. The significance of diet in dental health cannot be overstated. Recognizing the role of fermentable carbohydrates in the development of caries is paramount. By understanding how dietary choices impact oral health, we can educate our patients and their families on making informed decisions that support cavity prevention and overall well-being. Fluoride. Fluoride stands as a cornerstone in our arsenal against dental caries. Delivered in various forms, some of which require minimal patient action, fluoride plays a pivotal role in strengthening enamel and inhibiting the progression of tooth decay. While there's no magical solution that renders teeth completely resistant to decay, fluoride remains a crucial element in our preventive strategies. Fissure sealing. Fissure sealing emerges as a highly effective preventive measure, primarily targeting caries in pits and fissures. However, it's important to acknowledge its limitations, including cost considerations and the potential for sealant detachment over time. Despite these challenges, fissure sealing remains a valuable tool in our efforts to protect vulnerable tooth surfaces and minimize the risk of decay. As we delve deep into each of these pillars, we'll explore their significance in pediatric dental care and practical approaches for implementation. By embracing these key components, we can work towards creating a solid foundation for lifelong oral health and well-being in our young patients. Let's embark on this journey together as we unravel the key pillars of prevention in pediatric dentistry. Let's delve into why prevention forms the bedrock of dental care for children. Prevention versus cure. In the realm of dentistry, prevention reigns supreme. It's not merely a mantra, but a guiding principle that underpins all aspects of dental care, especially for children. By prioritizing preventive measures, we not only to avert dental diseases, but also to foster lifelong habits that promote oral health and well-being. Complexity of behavioral changes. Implementing preventive strategies in pediatric dentistry isn't without its challenges. It involves instigating behavioral changes, which can be inherently complex. From encouraging regular brushing habits to promoting healthy dietary choices, navigating these behavioral shifts requires a comprehensive approach tailored to each individual's needs. Tailored treatment strategies. Recognizing that every child is unique, we emphasize the importance of tailored, comprehensive treatment strategies in pediatric dental care. By taking into account factors such as oral health status, dietary habits, and socioeconomic background, we can provide personalized care that addresses the specific needs of each patient. Epidemiological distribution of dental caries. Understanding the epidemiological distribution of dental caries is key to our preventive effort. Dental caries distribution follows a bimodal pattern, with a significant portion of the disease concentrated in a minority of the child population. This necessitates a dual approach. Maintaining good dental health, ensuring that children without decay maintain good oral health through regular preventive measures. High caries risk groups. Directing resources towards high caries risk groups, including caries-prone individuals, children with early childhood caries, handicapped individuals, socially deprived populations, and ethnic minority groups often concentrated in urban areas. Low caries risk children. On the other end of the spectrum, low caries risk children who are caries-free or well-controlled, demonstrating good oral and dietary habits. These children are highly motivated and regular attendees at dental appointments, serving as exemplars of successful preventive care. By embracing these principles and understanding the epidemiological distribution of dental caries, adopt a targeted approach to prevention that maximizes impact and promotes optimal oral health for all children. Let's break down plaque control and toothbrushing for kids. Plaque control. Plaque disclosing agents. These are like magic potions that help us see where plaque is hiding. They come in tablets or solutions. But they need adult supervision because they stain your teeth temporarily. We use to track how well you're cleaning your teeth and figure out where you need to do better. Toothbrushing. How often? Brushing should be like your morning and bedtime rituals, something you do twice a day. Toothpaste. Use toothpaste with fluoride, which helps keep your teeth strong. There are lots of fun flavors and designs to choose from. Brush types. Whether you use a regular or electric toothbrush, both work well to clean your teeth. Supervision. If you're under 5, you'll need some grown-up help. And even after that, it's good to have someone watch until you're around 7 and can brush on your own. Fluoride toothpaste amount. For littles, a tiny smear is enough for kids under 3. For older kids, a pea-sized blob is perfect for those over 3. Rinsing technique. After brushing, it's best not to rinse right away. Instead, swish the toothpaste around in your mouth without water. This helps keep fluoride in your mouth longer, your teeth even stronger. Remember, keeping your teeth clean is like taking care of a secret treasure. You have to work to find and protect it. So, grab your toothbrush and let's set sail on our adventure to a sparkling smile. Caries prevention. Dental caries prevention logically involves removing plaque through effective toothbrushing. Important for controlling gingivitis and conveying fluoride to the tooth surface. Improved toothbrushing alone may not consistently result in caries reduction, but it plays a critical role in overall oral health. Flossing studies. Mixed results. Daily flossing in young children reduced caries in one study. Older children flossing their own teeth showed no preventive effect. Trials with intensive preventive advice and prophylaxis yielded significant caries reduction in one study, but faced challenges in replication. Chlorhexidine rinsing. Prevents plaque growth when rinsed twice daily. Short-term use recommended due to intraoral side effects, changed taste, poor taste, tooth staining. Mainly advised to aid periodontal care. Let's simplify nutrition and diet tips for preventing cavities. Baby bottles. Stick to milk or water, skip sugary drinks. Toddler cups. Encourage cups with lids or straws to reduce spills. Healthier snacks. Choose snacks like cheese, fruit, veggies, or nuts instead of sugary treats. Be cautious with citrus fruits and peanuts due to risks of tooth erosion and choking. Better drinks. Look for drinks that don't harm teeth by making them too acidic. Eating habits. Meals start acid attacks on teeth, but saliva helps repair the Snacking too often can wear away enamel with little chance for repair. What science says. Research shows fluoride toothpaste can protect against sugar's harm. Studies found brushing twice daily with fluoride paste can offset up to 7 sugary snacks daily. Practical advice. Take good care of your teeth. It's okay to eat up to 5 meals a day. So, remember, drink smart, snack wisely, and take care of those pearly whites for a healthy smile. Here's straightforward practical diet advice. 1. Confectionery and treats. Save sweets and treats for after meals instead of snacking between meals. 2. Baby bottles. Stick to milk or water only in baby bottles. 3. Soft drinks. Preferably, offer soft drinks only with meals. If possible, use a straw when drinking. Avoid giving soft drinks before bedtime or during the night. By following these simple tips, you can help protect your child's teeth and promote good oral health. The mechanism of caries and the role of fluoride. Mechanism of caries. Caries formation. Evidence shows that cavities develop due to acidic plaque on tooth surfaces. Mineral diffusion. Acidic components seep into tooth mineral, causing calcium loss and dissolution of magnesium and carbonate. Spot lesion. The first sign of decay is a white spot on the tooth, indicating decalcification under the surface. Remineralization and fluoride. Rehardening. Tooth enamel can reharden with saliva exposure, but fluoride is crucial for this process. Fluoride's role. Fluoride in the mouth, especially at the enamel junction, is vital for preventing cavities. Topical action. Unlike previously thought, fluoride's effectiveness is mostly due to its topical application rather than systemic ingestion. Effective at low levels. Even small amounts of fluoride, as low as 0.10 ppm, can prevent enamel erosion. Saliva and fluoride levels. Fluoride in saliva. The level of fluoride in saliva is essential for cavity prevention. Caries susceptible versus caries resistant. People prone to cavities usually have lower fluoride levels in their saliva, less than 0.02 ppm, while those resistant to cavities have higher levels, greater than 0.04 ppm. In short, cavities form due to acidic plaque attacking tooth mineral, but fluoride helps by promoting remineralization and preventing further damage, especially when present in saliva at adequate level. Fluoride products and methods for preventing cavities. Fluoride products. Available in different forms for both internal, systemic, and external, topical, use. Can be applied by professionals or at home. Fluoride methods for preventing cavities. Water fluoridation. Adding fluoride to community water supplies. Historically set at 1.0 ppm, parts per million. Shown to reduce cavities by 50% in 113 studies across 23 countries over 60 years. Cost-effective but faces some opposition. Fluoride tablets or drops taken orally. Varying effectiveness, 20% to 80%, and poor patient compliance, especially in high-risk groups. Can cause fluorosis if not used properly. Dosage depends on age and fluoride level in drinking water. Other systemic fluoride methods. Adding fluoride to salt, milk, or mineral water. Shown to reduce cavities by different percentages in various countries. Overall, fluoride is an effective way to prevent cavities, whether it's added to water, taken as supplements, or included in other products. It's important to follow recommended dosage and guidelines to maximize its benefits while minimizing risks. Fluoride levels and fluorosis risk. There's a concern about consuming too much fluoride, which can increase the risk of fluorosis, a condition that affects tooth enamel. Fluoride can be found in various sources like bottled water, baby formulas, chewing gum, and certain foods, adding to daily fluoride intake. People living in areas with fluoridated water might unknowingly consume more fluoride through processed or canned foods, known as the halo effect. Conclusion. Understanding how cavities form from acidic plaque and the importance of topical fluoride in preventing enamel damage highlights the need for targeted prevention. Different methods like fluoridation and supplements offer varying levels of effectiveness in reducing cavities. It's crucial to consider fluoride levels, compliance with recommended dosages, and potential hidden sources to develop a comprehensive preventive strategy. Fluoride-containing dental products, specifically toothpaste. Fluoride-containing toothpaste. Introduction. Since the 1970s, using toothpaste with fluoride has significantly reduced cavities worldwide. Types. Fluoride toothpaste can contain sodium fluoride, sodium monofluorophosphate, MFP, amine fluoride, or stannous fluoride, recently reintroduced with stabilization. Concentrations. Toothpaste for kids usually has less than or equal to 750 ppm fluoride, while adult versions typically have 1000 or 1450 ppm fluoride. Efficacy. Studies show that toothpaste with at least 1000 ppm fluoride is effective in preventing cavities. High concentration pastes. These are available with a prescription for people at high risk of cavities, but they need to be used cautiously in children to avoid fluoride toxicity. Toothbrushing with fluoridated toothpaste. Burt's View, 1998, describes using toothpaste fluoride while brushing as nearly ideal for public health. In simple terms, using toothpaste with fluoride is a great way to prevent cavities. Systematic reviews and guidelines for fluoride products. European Academy of Pediatric Dentistry, EAPD. Fluoridated toothpaste, EAPD measures its effectiveness in preventing cavities. They provide evidence-based statements and recommendations for children's use. Fluoride gel. Professional use. Dentists apply high fluoride gels, 1.23%, using trays or brushes, reducing cavities by 26%. Safety. Caution is crucial to prevent toxicity, especially in kids. Home use gels. Concentration. Gels with 1000 to 5000 ppm fluoride are used at bedtime alongside brushing, reducing cavities by 36%. Fluoride mouth rinses. Types. Daily, 0.05% sodium fluoride, and weekly, 0.2% sodium fluoride, rinses. Timing. At different times than brushing for better fluoride exposure, reducing cavities by 20 to 50%. Fluoride varnishes. Example. Durafat contains 5 Wt% fluoride, 600 ppm. Application. Use sparingly due to potential toxicity, especially in kids. Cavities reduction. They decrease cavities by 50 to 70%, according to studies. In short, these fluoride products, like gels, rinses, and varnishes, have been shown to effectively reduce cavities. However, caution is needed to prevent fluoride toxicity, particularly in young children. Slow-release fluoride devices. Research objective. Scientists aim to create devices inside the mouth that release fluoride steadily for at least a year. Fluoride glass devices. Developed in Leeds, these devices release fluoride for over 2 years. Clinical trial results. Studies showed a 67% decrease in new cavities and a 76% reduction in new cavity spots in children at high risk of cavities. Promising application. These devices are ideal for groups prone to cavities, people who don't visit the dentist often, and those with health issues. Conclusion. With various fluoride dental products available, there are many options for preventing cavities. Fluoride toothpaste, gels, mouth rinses, varnishes, and new slow-release devices all help reduce cavities. It's important to choose products based on individual needs and risks, focusing on effectiveness while minimizing the risk of side effects, especially in vulnerable groups. Casein phosphopeptidomorphous calcium phosphate, CPPACP, and its remineralization mechanism. Remineralization mechanism. Dependency on saliva. Remineralization of teeth relies on calcium, Ca2+, and phosphate, PO4-3, ions from saliva. Of fluoride. Enhancement. Fluoride speeds up remineralization and encourages the formation of stronger fluorapatite. Limitation. Fluoride's effectiveness depends on the availability of calcium and phosphate ions in saliva. CPPACP technology. Definition. CPP stands for casein phosphopeptidomorphous calcium phosphate. Commercial products, available in topical creams, like tooth mousse, and chewing gum. Stabilization mechanism. CPPACP stabilizes calcium and phosphate ions using phosphorylated serine groups. Remineralization effect. It helps create concentrated solutions, promoting remineralization through concentration gradients. Oral retention. Stays in the mouth for up to 3 hours, providing a continuous source of calcium and phosphate ions. Interaction with fluoride. Enhances fluoride's effectiveness in the mouth. In summary, CPPAC technology helps remineralize teeth by stabilizing calcium and phosphate ions, which are essential for the process. It works alongside fluoride to promote stronger, healthier teeth. The application and recommendations for CPPACP. Preventive agent. It's recommended for children at risk of dental cavities as a preventive measure. White spot lesions. It's beneficial for individuals with early-stage cavities, white spot lesions, to aid in remineralization. Usage guidelines. It's suggested to use CPPACP after brushing, both at night and in the morning, especially for children at high risk of cavities. Fluoridated CPPACP cream. Products like Tooth Mousse Plus, containing fluoride, 900 ppm NaF, can enhance remineration effectiveness by around 25%. Generally, it's advised for children over 10 years old to reduce the risk of fluorosis from ingestion. In essence, CPPACP can be a valuable tool in preventing cavities and treating early-stage decay, especially when used alongside fluoride. It's important to follow guidelines for optimal effectiveness and safety. Fissure sealing technique and advances in sealant technology. Fissure sealing technique. Prophylaxis, before etching. It's not always needed, but advisable if there's a lot of plaque. Using a dry brush is better than paste to avoid retention in fissures. Isolate the tooth surface. This step is for a successful sealant application. Etching, applying 37% phosphoric acid for 20 to 30 seconds to prepare the tooth surface. Wash and dry. It's important to keep the tooth isolated and dry during this step. Apply resin. The resin is applied and then cured to harden it. Check adequacy. Make sure the sealant covers the fissures properly. These steps ensure that the sealant is applied effectively and provides the best protection against cavities. Sealant materials and application techniques. Sealant materials. Most effective material, BIS-GMA resin, is considered highly effective. Types: sealants come in autopolymerizing or photo-initiated resin forms, and they can be filled or unfilled. Preference: photo-initiations are preferred for their convenience, but unfilled materials have shown superior effectiveness in clinical trials. Operator teamwork. Sealant application, it requires effective teamwork between the operator and nurse. Isolation techniques, cotton wool and suction. These are effective methods for isolating during sealant application. Rubber dam, while offering superior isolation, it may not always be practical to use. Glass ionomer sealants and their application technique. Glass ionomer sealants. Application technique, they are less sensitive than resin sealants during application. Retention issue, glass ionomer sealants generally have poor retention compared to resin sealants. Use cases. They can be used as temporary sealants during tooth eruption. Suitable for patients with anxiety or cooperation issues due to their simpler application. Effectiveness doubtful. Although they release fluoride, the clinical relevance of this feature remains uncertain. Advances in sealant technology. Bonding agents. Reduce contamination impact. They help mitigate the effects of slight salivary contamination on sealant retention. Prolonged procedure. However, using bonding agents can extend the procedure time, which increases the risk of contamination. Single-stage systems. Effectiveness, they work well on cut and smooth surfaces, but may not provide predictable results on occlusal surfaces. Sealing smooth approximal surfaces. Research, studies are being conducted to evaluate the effectiveness of conventional sealant resin in preventing the progression of caries on smooth surfaces. Infiltrating resins. Development, these resins are designed to penetrate carious lesions rather than simply coating the surface. Success rates, reported success rates are around 80%, with only 20% of lesions progressing. Procedure, involves applying 15% hydrochloric acid followed by resin penetration, which requires the use of rubber dam and local anesthesia. What are preventive resin restorations? Preventive resin restorations, PRRs, are conservative restorations meant to treat minimal occlusal caries lesions. They aim to conserve tooth structure, enhance aesthetics, and improve the bond between the restoration and the tooth. Advantages. Restoration of tooth structure. PRRs limit preparation to carious pits and fissures, preserving healthy tooth structure. Aesthetics. They provide improved aesthetics compared to traditional restorations like amalgam. Restoration to tooth bond. PRRs offer a strong bond between the restoration and the tooth. Longevity elements. PRRs have shown good longevity and performance similar to amalgam restorations. Regular monitoring and maintenance are necessary to prevent potential loss over time. Indications and contraindications. PRRs are suitable when some fissure areas are carious, while others are not, with limited forces. They're contraindicated in cases where there's extensive caries or significant occlusal forces on the tooth. Technique. Preoperative evaluation and rubber dam isolation are crucial. Conservative preparation removes demineralized dentin and unsupported enamel. No pulpal protection usually needed. Restorative resin composite is used for deeper areas, while sealant or flowable composite is used for shallow preparations. Occlusal anatomy is sculpted before curing, and sealant is applied over the restoration. Final adjustments and surface sealing are done after curing, and occlusion are applied. In essence, PRRs offer a conservative approach to treating minimal occlusal caries lesions, preserving tooth structure while providing aesthetic and functional benefits. The technique for placing preventive resin restorations. Step-by-step technique. A. Preparation. The occlusal surfaces of the premolars show demineralization in deep fissures. A rubber dam is placed and inverted, with occlusion marked before its placement. B. Initiation. A small round burr, no 1/8, is used in a high-speed handpiece to initiate preparation. C. Further preparation. Burrs of different sizes, 1/16, 1/8, and 1/4 round burrs, are used to open occlusal fissures. D. Alternative preparation. Fluorotomy burrs, SS White, can also be used to open occlusal fissures. E. Completed preparations. Preparations are limited to access for removing carious tooth structure. Preparation is mostly confined to fissure enameloplasty. Penetration to dentin is minimal, occurring in limited location. F. Adhesive system placement. After applying the adhesive system, restorative resin composite is syringed into deeper areas of the preparation. G. Developing occlusal anatomy. A hand instrument, like the PKT3, is used to develop occlusal anatomy in the final resin increment before curing. H. Final steps. The occlusal surface is re-etched, and occlusal sealant is placed over the resin composite and remaining pits and fissures. I. Completion. The occlusal preventive resin restorations are completed. This technique aims to effectively remove carious tooth structure and restore the occlusal surfaces with resin composite, providing long-lasting protection against decay.